My name is Christine Perez, and welcome to another episode of Cafecito con NHCOA. Today, we have a very important and relevant topic for our Latino community, tobacco and its impact in the Hispanic and Latino communities. Tobacco is a threat that affects people of all ages, from young people to older adults. To help us better understand this issue and how we can address it together, we have a very special guest today, Claudia Rodas. She's the Southern Region Director for the campaign for Tobacco-Free Kids. We're going to look at how tobacco affects our Latino community, from the youth who are at a high risk of starting to use tobacco to the older adults who can have a significant impact on the new generations. In addition, we will discuss policies related to menthol cigarettes and how this specific product pose a particular risk. And of course, we want to learn how we can be more active in efforts to combat this problem in our community. So get ready for this important discussion and conversation about our well-being. Let's get started.
To put it plainly, tobacco use affects all our households, whether it's being used in our households or not. It's all around our communities. It could be being sold down, the street at our grocery stores or convenience stores. It's being used in our children's schools, and all of us are sharing the cost to treat any tobacco use health-related diseases. So whether or not it's directly impacting us, it's definitely indirectly impacting our households as well. It's important to note that smoking prevalence has been on the decline for years. So despite we're seeing cigarette smoking on the decline, smoking still remains the leading cause of preventable death across the United States. Smoking harms nearly every organ of the body, and according to the 1998 U.S. Surgeon General's report, smoking and other tobacco use takes its toll on the health of Hispanic Americans. So we are seeing illnesses, and we continue to see these illnesses such as cancer, heart disease, stroke, all of them which could be caused by cigarette smoking. And they're all leading towards death among our Latino community. We know that more than 43,000 Hispanics are diagnosed with a tobacco-related cancer each year, and more than 18,000 of them die from a tobacco-related cancer each year. Number one being lung cancer. So it's definitely making a direct impact, like I said, among our communities, and it's something that we should be aware of. Cigarette smoking is definitely on the decline, but that doesn't mean that we're seeing declines across other type of tobacco products, particularly around electronic cigarettes. In fact, electronic cigarettes are the most commonly used tobacco product among our Hispanic high school students. In 2023, 9.7% reported currently using these type of products. And then following e-cigarettes, cigars are the second most popular product among our Hispanic youth. And then we have, in lower amounts, but definitely still being used, the smoking combustible cigarettes, so the traditional cigarettes. They're using other type of smokeless tobacco products like the chewing tobacco. A new product that's out in the market that we've been monitoring is something called Zen, which are nicotine pouches that students can put in their mouth, and other type of heated type of products. We don't have much data point, but particularly among our our older young adults, there's a lot of hookah usage that's being used in bars and other type of locations, and so there are a variety of different type of products that kids can access, but e-cigarettes definitely the most popular one. The federal government passed in 2020 the law to make 21 years old as the age. You have to be 21 or older to purchase these type of tobacco products. But when we work with our state partners and state health departments, what we're finding, and while, retailers will challenge and say, well, we are not selling to our youth. Anecdotally, I can tell you, I've heard from many of the youth and young adults that we work with that they know exactly where they can buy these products. So it's those vape shops right down the street. There's a lack of enforcement, a lack of resources to enforce. And so many times, whether it's youth being able to buy these products down the street, and that retailer knows that no one's going to come in and fine them or have any consequences. They're selling to our youth, and sometimes they also get them from older siblings or older adults that they're around. Absolutely. A ban on menthol cigarettes can have a direct impact on tobacco use among our Latino communities. At the local level and at the state level, we are working with many partners to try to pass what we call restrictions of sales of flavored tobacco products. So that's us working in the ground in the communities, trying to make a direct impact. At the federal level, at a much more broader level, we have been challenging the FDA to use their authority on regulating the marketing and sale of tobacco as a ways to combat the infiltration of the tobacco industry into our Black and brown communities. As early as the 1980s, the tobacco industry has attempted to capture our Hispanic market. We have seen tobacco industry documents that reflect that the industry's early enthusiasm for the Hispanic market. So they said this is a young, growing, geographically concentrated, and brand loyal market. And so they came after our Latino communities. As I mentioned, we continue to push the FDA to use their authority on regulating the marketing and sale of different tobacco products. In 2022, after more than a decade that the FDA proposed regulations to prohibit menthol cigarettes as well as flavored cigars. We had waited over a decade for that to happen, and it did happen very recently. But in October 2023, fast forward October 2023, the FDA sent that final rule to the White House of Office of Management and Budget for review. And shortly after that, in December of 2023, so just less than a year ago, the Biden administration delayed issuing that final rule after they met with the tobacco industry and with the top officials at the White House. So we continue to push the Biden administration to end those delays and act to protect our kids and our communities from tobacco addiction. We talk with audiences just like in your group that we're talking to right now to join in those efforts. Why? Because we're the ones seeing the impact in our communities and our children. Well, plainly, if we don't talk to them, who will? Over 5,700 kids start vaping every day, mostly because of misconceptions, peer pressure, the marketing tactics I just talked about. They all have contributed to our youth using these products. So it's our responsibility, right, as adults to talk to our kids about e-cigarette use while they're still willing to listen. Just like any other topic that we would sit down and talk to them, we want to empower them to make good choices. Sometimes we think we don't have influence over our kids, and we need to remind ourselves that we have more influence than we think. Educate ourselves with the facts, learn about what is causing danger, to our youth. I always like to tell people our kids have the world in their hands by, the phones that they have now, access to almost any information at this junction. And so So, we need to sit down. We need to talk to our children. We need to talk to them about how to take care of their bodies, and how to reject sort of these peer pressures on using any type of dangerous product, including tobacco products. Anecdotally, that I have worked with and talked to say that they think that electronic cigarettes are not harmful, or they are not as harmful as traditional cigarettes or other type of products. And I think it's important that our youth realize and know that the same type of vapors, anything that we are inhaling into our bodies, does have an impact, particularly, down the road, cancer, heart diseases, lung cancer in particular, and making sure that they're aware how particular disease, that we're prone to particular diseases more than others. And so, it's not a fear tactic, I would say, to scare our youth, but it's important for us to talk to them about how important it is to take care of our mind, our bodies, and our souls. Well, our website, it's www.tobaccofreekids.org. Our materials do tend to be more educational, general education, statistics, advocacy focus, how to make changes in your community. But we have several partners that we work with both at the national, state, and local level that offer additional material. So one good resource is Parents Against Vaping. They're a great resource. They have resources for parents and adults on how to talk to your kids about these products, or about tobacco use in general. Some guidance and materials available both in English and in Spanish. Another great partner group that we work with is the American Lung Association. They also have some resources available online. Again, how to talk to your kids about vaping and about using other type of tobacco products. And a couple other ones is the CDC, so the Center for Disease Control. So just Google Center for Disease Control or CDC, talk to your kids about vaping. They have some great resources. And lastly, one other great partner is the Truth Initiative. And they also have some materials, not only about how we as adults can talk to kids about the dangers of using tobacco, but they also have some great resources for youth and young adults and how they can engage and educate and even make changes in their community and within their schools. And then every state within their state health department has some type of prevention program in their state. So if they're not, any audience member that is interested but can't find that information, we welcome those questions, and we would be happy to put them in touch with a local partner. We know we can't do this alone, and so this is why we sort of hold hands and try to provide these resources to all communities. So according to the latest data from the 2022 National Youth Tobacco Survey, over 2.5 million kids in the U.S. are current e-cigarette users, and 85% of them use flavored products. Many are using these products most days or every day, which is a sure sign that they're becoming addicted. We know that eliminating the sale of flavored tobacco products, particularly flavored e-cigarettes, is a critical step towards ending the tobacco industry's modern-day pipeline of youth addiction. And this is why we've started campaigns across the country. The audience member can visit not only our website that I mentioned earlier, tobaccofreekids.org, but we also have a different website called takedowntobacco.org. So again, www.takedowntobacco.org. There is an interactive map on that page that mentions many of the campaigns that are active that we're working on. And if there's not anything that you don't see your community or your state highlighted, we again welcome you to come and reach out to us and see how you can start something, and how your audience members can be part of this movement. Again, those websites are www.tobaccofreekids.org and www.takedowntobacco.org.
Thank you for joining us today and for being part of this powerful conversation about the impact of tobacco on our Latino community. We hope that the insights shared by Claudia Rodas have been informative and inspiring. Tobacco use is a serious issue that requires our collective efforts. We encourage you to stay informed, get involved, and spread the word in your own communities. Every action counts. If you want to learn more or get involved in the campaign for tobacco-free kids, visit their website, and don't forget to stay connected with us at NHCOA by following our social media channels for updates and more information on other public health matters. Thank you again for tuning in. Until the next Cafecito con NHCOA. Take care. Let's continue working together for a tobacco-free Latino community. Hasta la próxima. Bye.